Your surgeon has requested that you have an interscalene block prior to your surgery.
A nerve block is very similar to going to your dentist who injects your gums for dental procedures.
An interscalene block is a nerve block that we do to anesthetize the shoulder and the upper arm.
When we perform an interscalene block, we inject medication around this portion of your neck to anesthetize the nerve going to the shoulder.
When it's time for your operation, we'll take you back to the operating room and we'll put on the monitors that we've previously discussed. At that time, we'll have you turn onto your non-operative shoulder so that your operative shoulder is facing the ceiling. We'll also have you put your arm behind your thigh, and in doing so, it helps to pull the shoulder down, exposing the area of the neck where we're going to be doing the procedure. We'll be taking some pictures of your neck with the ultrasound machine. When it's time for us to do the block, we'll be numbing up the skin next to the ultrasound machine with a small needle. Using the ultrasound machine, it'll help guide us safely and accurately to the nerves that we wish to block. Prior to the injection, you may feel some twitching in your shoulder or your arm. Your anesthesiologist may be using a nerve stimulator to also help us locate where your nerve lives. Following this, they'll inject the medicine through the needle, and you may feel some pressure in your neck or even into your arm. If it becomes uncomfortable, please let your anesthesiologist know. We can slow down the injection and that pressure will go away.
Following the block, we will remove the needle, leaving nothing behind but the medication. Then we'll put you back on your back, have you breathe some oxygen before falling off to sleep.
Your interscalene block should last approximately 8 to 10 hours. Occasionally, they even last into the next day. The interscalene block will anesthetize your shoulder and your upper arm, and perhaps even your entire arm will be numb for several hours. It is very important after the block that you take your pain medicines on a regular schedule until the block wears off. What we're hoping to do is to build up some pain medicines in your system so when the block does wear off, you have some pain medicines to help combat the pain that you will feel after your nerve block wears off. Once your block is worn off, you can continue to take your pain medicines as directed.
And thank you for choosing Premier Bone and Joint Centers.